kids are headed back to school, and there's something on a lot of parents' minds: vaccines. Conversations, even confusion, has been making headlines as Health Secretary Robert F. Kennedy Jr. scrutinizes all shots for children and adults. Vaccination rates for kindergarteners continued on a downward trend across the country last year, with 3.6% of them getting exemptions from one or more vaccines. So what do parents need to know? CBS News medical contributor Dr. Celine Gounder is here to break it all down. She is, of course, also editor-at-large for public health at KFF Health News. Dr. Gounder, thank you so much for being here. So we'll talk about vaccines, then we'll get to the weight loss drugs. So we have two big buckets, right? There's the COVID vaccines and then the childhood immunizations. What should parents know about each?
Look, there's a lot of noise out there. Parents should really stick the course and make sure that their children get all of the routine childhood vaccinations. And there will be more announcements coming from professional societies about this in the coming weeks. With respect to COVID vaccines, the American Academy for Pediatrics has reaffirmed that infants, children between the ages of 6 months and 2 years should get their COVID shots. The first encounter with COVID should be with the shot, not with the virus. There is still a very high risk in younger children, particularly 6 months to 2 years, for hospitalization and severe complications if they get COVID. And pregnant women should be getting the COVID vaccine. This is pregnancy is a state of immunosuppression, so it is for the protection of the mom, as well as the best way to protect the baby, both the fetus as well as the infant in their first 6 months of life.
The Vaccine Advisory Committee recently limited use of a preservative called Thimerosal, and is now looking at other chemicals in vaccines. Why are these part of the vaccine? What's their use?
So thimerosal is a form of mercury. Now, people hear mercury and they think, oh, that's dangerous. We're talking about a specific form of mercury, ethyl mercury, which is not the dangerous form. The dangerous form is methyl mercury with an M, so MM. And routine childhood vaccines have actually been thimerosal-free for years now, so it's not really even an issue. So big picture, if you're going to worry about methyl mercury, worry about broken thermometers and those skin lightening creams, not about the vaccines. Okay. Now, aluminum is another one Kennedy has also been concerned about. Aluminum nudges the immune system so that you get a longer-lasting, more robust immune response with fewer doses. So that's a bonus, and there's no evidence that it's harmful.
So the Health and Human Services Secretary also has cited a lack of placebo-controlled vaccine trials. I mean, when we all studied science, like, you have to have a placebo group. Is he wrong about this? Is he right?
This is wrong. So, for example, remember the COVID vaccines, when those were being studied during the pandemic. Those were millions of people being studied in various different controlled trials against a placebo, so against no vaccine at all. So there is a very strong track record of vaccines in randomized placebo-controlled trials.